Welcome to City Week, ladies and gentlemen. Today I have a guest on from West Georgia Health. He's with the West Georgia Physicians. I have the Vice President, David Brisbrow. David, welcome to the show.
Thank you very much.
Well, it's a pleasure to have you on the show. And I know this is our first time sitting down. I want to make sure that I know there's a great group of physicians that's going on in our community. We want to talk a little bit about that. But before we do that, because I don't think that I've had the pleasure of meeting you before, I want to know a little bit about David. First of all, talk about your role there with West Georgia.
Sure. I moved here in May from Cincinnati, Ohio. I was with the University of Cincinnati, Cincinnati Physicians. And I was fortunate enough to come meet the team here in LaGrange and have been brought in to operate and help to build a multi-specialty group called West Georgia Physicians. And in that role, I'm serving as the executive director, and we're a growing group of hospital-affiliated physicians.
Okay, very good. Hospital, and I know that I come in on Lafayette Parkway, and there's another healthcare provider there, I think, that is not affiliated with you all, but you all are in that area, correct?
We have primary care offices on Lafayette Parkway by the mall. We have an office in Hogansville that we operate, and then we've got 2 internal medicine practices in Medical Park, along with cardiology and surgery and urology and a handful of other things.
Oh, okay. Well, very good. Seems like you all provide an array of services there. Now, I was going to ask you about what were some of the services, but you just kind of mentioned some of those there. Well, let me ask, because what is the thinking behind West Georgia Physicians, and how do they differ from, say, a person with a primary health care provider, and what's the difference there? Help me understand that, David, if you don't mind.
Well, it's kind of a growing trend nationally that physicians and hospitals are becoming more integrated. In this particular model, it's an employed integration where West Georgia Health employs physicians, and we can employ them for a variety of different reasons. Some want to start to wind down their practices. Some are new physicians coming directly out of fellowship that don't want to go into a private practice. They don't want to own their own bricks and mortar. They want to be part of a group. For a variety of reasons, but we are a multi-specialty, hospital integrated practice.
Okay, all right. And when you say hospital integrated, that means you guys work closely together, I guess,
We're tied into the hospital computer system. We can access the imaging system. We've got direct access to the labs. We're a multi-specialty group so that care can better be coordinated.
Okay, all right. Now, when you mentioned a few moments ago about out in the West Georgia park there, medical park, I'm sorry, that you have a number of physicians, and I was just looking here over some of the things here, like primary care, surgery, cardiologies, occupational medicines, and urology. So you have physicians that are specializing in each one of these areas. Talk a little bit about that for us, Dave, if you don't mind.
That's right, and we also have gynecology services also.
Okay.
You know, they're a group of physicians that really function kind of independently, but part of a larger collective group. You know, we have excellent patient satisfaction. We provide almost immediate same-day appointments. If you need to get in to see a physician, it's very convenient to get in and see those physicians. And because we're a multi-specialty group, we can coordinate those people that need, you know, a specialist. You know, you might come in for a checkup and find out, you know, you need a vascular person, or you ought to maybe have you see your urologist, and we can easily coordinate those needs. And because we're tied in with one medical record, the specialist has access to the same information that your primary care doc does. So, you know, they know what medications you're on, they know what's your history has been, and it really makes for a more efficient encounter for the patient.
Oh, okay, all right. So I guess it's fair to say then, if someone didn't have a primary health care physician, that they could come to the West Georgia Physicians and perhaps, I guess land a primary physician?
Well, absolutely. I would encourage that people that don't have a primary care physician find one, whether that be West Georgia Physicians or somebody else in the community. But definitely you need to have somebody shepherding you through that process and keeping you healthy. You know, the world is changing in healthcare in that, you physicians in the past have gotten paid for doing things to you. And in the future, we all believe that they're going to be paid for keeping you healthy and minimizing your risks going forward. And prevention is going to kind of be the name of the game, I think, going forward.
Absolutely. Talking about prevention, we were talking before we came on at the City of LaGrange, we do have a healthcare preventative maintenance plan where, basically you get paid to stay healthy. We have the Cooper standards that we go through where you do runs, sit-ups and push-ups, and if you pass that, you get a reduction on your health care, or you can go to the a gym at least 10 times a month, you get a credit towards your insurance as well, along with other things like your blood pressure, BMI, cholesterol, smoking, things of that nature. So you're absolutely right. And I see we started that some, I guess, 6-7 years ago now.
West Georgia Health has exactly the same program in place, and we're seeing more and more employers put those kind of things forward. And the fact of the matter is if you pay attention to your health early on, and if you get the preventative checkups, there's a whole lot of things that are easily fixable if they're early detected. That become significant problems if you don't do that. So it's really a beneficial program, and I think it lowers the cost of health care to the employers, which is a big concern to them nowadays.
Absolutely. In talking about cost to the employers and everything, and we talked a little bit about insurance, let me just ask a question, and I know I'm going to ask one that I know, first of all, of course, you all accept insurance.
Absolutely.
Let's say someone came in that didn't have insurance coverage. How is that person treated?
Well, the same as the person that has insurance.
Right.
We take all comers, and we accommodate that need. And there are people that come in with no insurance, no benefit for a variety of reasons. Sometimes they're in between a job, they're going to be insured at some point. Sometimes they're not on a government plan that they should be, and so if that's the case, we see them and we help to get them on those Medicaid, whatever plan it might be.
Okay. That was going to be my next question. If someone came in and I used the wrong word, treated, I shouldn't have said, but how they, I guess, seen or what is their remedy for not having that? And you say you all have a program to help them.
That's right.
To line up with those various programs.
That's right. A lot of times people don't know, and they go to the ER, and the ER is a very costly place to go. And if you're going there for the flu or cough or something very, very minor, it's a very costly office visit. It's much better to come to a primary care doc, get in the system. We'll help you to the best we can get on whatever program you need to get on.
Okay, very good. Now, because you were mentioning in some of the services, it seems that there's a lot of specialized services there, but you also offer just a general practitioner type service as well?
Absolutely. We have 2 family practice physicians in our group. We have 2 internal medicine physicians in our group. We just had a obstetrical and not obstetrical, a gynecological group that does primary care for women, and so we've got significant capacity, and we continue to expand too.
Okay, well, very good. And how long has West Georgia Physicians been around, Dave?
Well, it's a fairly new organization. It's only been around for just a little over a year.
Okay, all right, well, very good. And I guess you were very instrumental with the startup of that.
Well, actually, it was started when I came here.
Mm-hmm.
I've been more involved in the growth and the programmatic development of West Georgia Physicians. We're in the process now of putting in a hospitalist team, so we'll have a hospital-based medicine department that takes care of the inpatient side, and then our other primary care docs and specialists will take care of the outpatient side.
Oh, okay, well, very good. And I think you kind of alluded to it a moment or so ago. What are some of the advantages of an individual using West Georgia Physicians over using their primary doctor? I think you kind of alluded to that a moment or so ago, David.
Well, we really pride ourselves at West Georgia Physicians on giving patients the best experience they can have, the best patient satisfaction experience they have, and that means that our docs are compassionate, and they're thorough, and there's good follow-up and feedback, and there's access to the hospital resources such as the medical records and the other specialists in the group. So I think that efficiency, we get you in fast, we get your diagnosis done quickly, we get you treated quickly, and those good patient experiences, I think are probably the best reason to come to West Georgia Physicians.
Okay, very good. Some good patient experience. And of course, you guys, you mentioned early on too the locations. We know, well, like I said, I passed one on Lafayette Parkway. Talk again about, you have other satellite offices in
We
Hogansville.
have a satellite office in Hogansville,
Okay.
full-time physician up there. We're looking to expand in the West Point area, and I would expect in the coming months we'll have a physician or two in the West Point area, and our subspecialists will also go to those locations to be a little more convenient.
Okay, all right. So, of course, here in LaGrange and West Point and Hogansville, and maybe looking to expand more so in the coming years, I guess.
I'm sure that as opportunity presents itself, as need presents itself.
Okay.
I will say that we did a physician needs assessment for the community, and that kind of guides,
Okay.
how our expansion efforts will take place. There are some gaps in this community with specialists and subspecialists that it would be beneficial to the community and fill a need. And so I suspect that we'll expand in a planned way moving forward, based really on the need of the community more than anything else.
Okay, well, very good. And I hear you use the term subspecialty. Help me to understand that a little bit, Dave.
Cardiologist, interventional cardiologist would be an example of a subspecialty.
Okay.
We have a bariatric surgeon that's here that's really focusing primarily on bariatric surgery, and we're fortunate to just become a center of excellence for that, and so that's a very high, distinguished accomplishment.
Okay, well, very good. Just in case someone was interested in contacting, calling out there, Dave, how can they get in touch with you all?
Well, one way is to call 706-882-1411.
Okay.
That'll get you the main number of the health system. We've got a website, westgeorgiaphysicians.com
Okay.
or .org, and that's another way to get a hold of us. And,
Okay. All right. Well, David, I want to thank you very much for coming on the show and sharing this information. And hopefully, instead of me passing by, I'll stop in one day, okay?
Absolutely.
All right.
Thank you very much.
Thank you too, Dave. All right.
Thank you.
Ladies and gentlemen, stay tuned. We're back on City Week in just a moment. Welcome back to City Week, ladies and gentlemen. Today, my guests are on from the Troup County Parks and Recreation. I have the facilities coordinator. I have J.J. Kersey. And I also have on the athletic coordinator, Carrie Whaley. Welcome both of you all to the show.
Good morning.
Thank you.
It's a pleasure to sit down with you guys again, because I know that the Parks and Recreations is in full swing and a lot of things are going on, and I think the kids are getting ready for the spring and the summer events to come on to take place, and I know that you two individuals have the finger on the pulse, right?
We're ready.
Y'all are ready. All
Ready.
right. Well, let's just kind of jump in here and talk about a few things that's coming up. JJ, first of all, we'll start out with you. Just tell us a little bit about what your role is there, first of all, and then we'll jump into some of the things that are going on.
Okay. I'm the facilities manager over at the Mike Daniel Recreation Center, and we have special events, and we also have ongoing monthly programs. And some of our programs we have 2 excellent Zumba instructors. We have morning classes and evening classes. We also have added a new Pilates class in the morning, and that's been wonderful. And then we have karate. We have petite ballet starting at age 2, and they are just amazingly adorable. I love having them come in because they are so precious. And Miss Miriam does an excellent job with that. We have cheerleading, we have swim team, and we also have belly dancing. So we have every night of the week at least 2 programs going on. So we've got stuff from ages 2 and up for anyone in the community. All of our things are very priced reasonably affordable for any working family or non-working family, and our goal is to reach as many people in our community and help them stay healthy and happy.
Absolutely. Well, good Lord, that was a lot.
We have a lot. We do.
I'm gonna jump back into a couple of those. You mentioned karate, belly dancing, Pilates, Zumba, and I know that Zumba has been here in the community now for about 4 years now, 5 years.
It has. It's been around at least 3 to 4 years,
Okay.
and it's they have it all around town, and I'm sure all of the instructors are excellent. but I'm a little biased, and you could probably agree. We've got probably 2 of the best Zumba instructors in town. And they have a steady following. The ladies and all that they touch and the kids love it, and it's a wonderful program for everybody, all ages.
Oh, very good. And I understand it's a pretty high intense aerobic.
It is. It's a great aerobic activity, but it's great to be adapted or modified according to your skill level, which is why I've got 2 of the best instructors. They both work on a little bit different clientele, so we're able to touch so many people. We have the younger crowds and the older crowds in the same classes. However, we've got varying times to reach everybody. And what makes it so popular is, of course, our instructors,
Right.
but that it's fun. You get in there and you're dancing and you're having a good time, and you forget that you're really working out. And that's what makes it great.
Well, very good. You know, I think when it started, I think it was offered on Thursday nights, and I would come by the center there, and the parking lot would just be filled to capacity with, you know, cars. I'm sure that people were doing other things as well, but I think when it first caught on, it was just a phenomenal thing that happened.
There was a lot of times there was 2 gym floors with women,
Wow.
you know, spaced out to where they had enough area to do what they had to do. But it sometimes 100, maybe close to 200 women at one
Oh, my
time.
Lord.
It was a lot.
Yeah. I mean, when you talk about that many individuals getting together for a particular program, it's fun. It's helping you to, you know, exercise the heart and, you know, getting the heart rate up and everything. Are men taking the classes now?
We have a few men that do it, but our evening instructor, she will sometimes do couples Zumba, and she does a couple special event Zumbas that men will come and experience that as well. But typically, it's an all-female class.
Okay. All right. Well, very good. Well, let's go over and I want to talk. I'm going to come back in a few moments
Sure.
because there's a couple other things, but I want to talk with ask Carrie, because I know that you got spring registration that's coming up, Carrie, and the kids are probably getting excited. You're probably getting excited. Talk a little bit about that for us.
Spring registration will begin January the 28th, and it will run through February the 8th. The registration will be held as the hours of the Mike Daniel Recreation Center open.
Okay.
You can come in, give you time, get off work, or come by before you go in. And we got kids that's playing we got a basketball program going on right now. And while you're out watching your child play basketball, you can stop at the front desk and go ahead and sign up for baseball or softball or spring soccer or what you want to play, you know, this spring.
Okay, very good. And you said it was during the registration is during the time that the center is open,
Yeah.
8 to 5, 6?
Actually, we're open 7 days a week.
Oh, okay.
And our hours of operation are on our website, which is trooprec.org. We open early 3 mornings a week at 5:30 in the morning, and we are there every night but Fridays until 8 p.m.
Okay.
So we're really accommodating to the early morning and the working families so that they can come in the evening time as well.
Okay, very good. So it's about 8 to 8, and then you got the early morning, so you can cover all spectrums there. And you talked about signing up for baseball, basketball, and things of that nature. And of course, you sign up by age categories. Talk a little bit about that for us, Kerry.
Starting with baseball, we play baseball ages 4 through 14. Our youngest age baseball will be T-ball for 4 and 5-year-olds. This program is run by Daryl Holsey. If you had any questions about coaches or scheduling and all that, contact him at the Parks and Rec at 883-1670. But the T-ball is for ages 4 and 5. Last season we had somewhere in the neighborhood of 20 teams, and we expect that many this time. Then we have an age group for 6 and 7-year-olds, which is actually coach pitch. And last season we had somewhere in the neighborhood of 16 teams. Then it goes into an 8-year-old age group, a 8-year-old pitch machine age group. And after that, it starts with the regular baseball, 9 and 10, 11 and 12, and 13 and 14. We play our games on Mondays, Tuesdays, and Thursdays. The younger age group, the 4 through 8, they have games at 6 o'clock in the evenings and at 7 o'clock. Typically, they're finished by 8 o'clock to get to get off the field, get home, get a bite to eat, and get ready for the next day. Get the kids in bed in time, for school the next morning, and not be out very late.
Keep us mamas happy.
The 9 and 10, 11, 12, and 13, 14, we play games at 6 and 7:30. We play our games at Harris Baseball Complex, and also play on Mondays, Tuesdays, and Thursdays.
Okay, well, very good. And you talking about that, my son called me the other day. I have 3 grandsons, 6, 5, and 3.
Really?
I do. 6, 5, and 3. And he was telling me he's signing them up for, T-ball and all of it. I'm like, okay, so I got to start going and watch them. And I do remember when they played T-ball a couple of years ago, and they have so much fun, and just to get the fundamentals down and just to see the kids out there running around the field, they'll hit the ball and they'll take off and run to third base and, things of that nature.
Absolutely.
It's hilarious. So I know that you guys are looking forward to that this upcoming. And you were talking about the various age groups. Now, what's the registration fee, or is there a registration fee?
The registration fee for spring sports is $60 per child.
Okay.
And according to what age you play in, we have an age cutoff to know which age bracket you will be in. It's your age as of this May the 1st. So
Okay.
whatever age you are on May the 1st, that's what age group that you would play in.
Okay.
We also have spring soccer going on, and then we will also have softball, girls softball starting as well. So Carrie can talk more about those as well, but we'll have, from an athletic standpoint, we'll have soccer, softball, and baseball, along with our monthly programs that continuously go on. The age cutoffs vary a little bit with softball and soccer,
Okay.
just because they're governed by a different governing body. But we can explain all that. It's on our website as well. But Carrie can talk about our soccer program
Okay, yeah.
and even our softball program a little bit as well.
Yeah, go ahead.
Spring soccer, the age groups are under 6 for 4 and 5-year-olds, under 8 for 6 and 7-year-olds, under 10 for 8 and 9s, under 12 for 10-year-olds and 11-year-olds, and under 15 for 12-year-olds, 13s, and 14s. The spring soccer is a progression. With the younger age groups, the U6 and U8, they play on smaller fields, smaller sided, to less kids on the field, where the child or the player actually has better opportunity to get his or her foot on the ball, to make contact, to have success. The U6 program, we don't use a goalie to let the kids score goals. It's not as hard to score a goal without a goalie, and
Right.
It's a progression. U8s, we put the goalie back in the box in front of the goal, make it a little bit more challenging. The U10, you play on a bigger field, few more kids on the field. That's when a referee's on the field. The games count. We keep score. The U6 and U8, we don't keep score. Everybody wins. Everybody has fun. And at age, when they get to the U10 age group, that's when it's more like real soccer. You got a referee on the field. Your game is timed, and you play 2 halves, and they keep score. And it's just a progression. It gets up to the U15, which is 11v11, like high school soccer or college soccer, and it's just a progression. Go from small-sided games up to the regular-sided soccer games.
Well, very good then, and I know that we have the soccer fields over off of Weissel Street there. And I
Fort
think
Drive.
And I think anytime you go by there, it seems like they're, completely filled.
It's always full.
So,
we play the younger ones, the U6 and the U8 age group over beside Whites Road Elementary School.
That's
The
right.
U10, U12, and U15s play at Soccer Complex on Fort Drive across from West Georgia Tech.
That's right. Well, very good. Like I said, and as the summer comes in and the weather gets nicer, I'm sure that the kids will just file in. One last thing before we finish up, Special Olympics.
Yes.
Mention that real quick.
Okay,
before
we've got, we're training for winter games right now, which basically we're doing basketball skills and team basketball, and we will go to Atlanta next weekend on that. However, in October, we went to Dalton, and I took about 80 people to Dalton to compete in various activities, and our unified softball team actually got second out of our division, and so we're very proud of them. And I know that this weekend, this coming up weekend, we're going to bring home lots of medals as well in the sport of basketball. So once that's over with, we'll start training for summer games, which will be swim team, soccer, and volleyball. So we stay busy. It's really a great thing. You can't say the rec department doesn't have anything to offer for everybody in this community, can you?
It's year round.
Year round.
Absolutely. Very good.
One more thing before we finish.
Okay.
Our girls softball and our adult softball program, one thing that we wanted to add, we're changing the way the age groups for the girls softball this year. We're changing to a 7, 8, and 9-year-old age group,
Okay.
which will be machine pitch. And then we have a 10, 11, and 12-year-old age group, which will be live pitch. They will play on Mondays, Tuesdays, and Thursdays. Also, our adult softball will have a co-ed league, which we made up of co-ed church, co-ed industrial, and co-ed open, and also men's league, men industrial, open, and church league. So
Okay.
contact Keith Williams at Parks and Recreation about the girls softball or the adult softball.
Okay, well, very good. Well, you know, we're very fortunate to have the Parks and Recreation in our community. I know they do a lot of great things. The kids take full advantage of it. So I'm sure, like I say, the phones will start ringing and get a number of kids signed up again. So I want to thank both of you all for coming on and sharing the information with us today.
Thank you very much.
Thanks.
Thank you all. Ladies and gentlemen, stay tuned. We're back for more City Week in just a moment. Ladies and gentlemen, thank you for joining for City Week this week. My guests have been from West Georgia Health, David Disbro, who is the Vice President of West Georgia Physicians, as he talked about the advantages of using a facility like this. And also I had on from Troup County Parks and Recreation, J.J. Kersey, and also Kerry Whaley. So ladies and gentlemen, we want to make sure that you take advantage of the information that they gave you about the spring registration. Go out and register your kids for all the upcoming events and make sure that you go out and take part of some of the monthly activities that they have going on. Ladies and gentlemen, thank you for joining for City Week this week. And as always, I want to invite you back for more of City Week.